Hey everyone, welcome back to my channel. It's Dr. Alessandro. Thanks for joining me. In this video, I'm going to be discussing something special. Now, this video is kind of intended for those of you viewers who are pre-dental students or any level of dental student, that is D1, 2, 3, and 4, so all the different years of dental school, and maybe even for some new graduates. This video is intended to describe the two one-year postgraduate residency programs that are certificate-based. That is, they're not necessarily a specialty, but they're certificate-based. One is called a GPR, or General Practice Residency. The other is an AEGD, or Advanced Education in General Dentistry. Like I said, these are one-year postgraduate residency programs. Now, what's so special about these programs, and what distinguishes one from the other? And should I take one if I am going to, if I'm not decided, I don't know what I want to necessarily do after dental school? Well, the last question, the answer is yes. Take one of these residency programs. Apply for them and take one. Whichever one you happen to get into, you can apply for any number. I know it's probably going to cost some money to do so, but I do encourage you to apply, especially because of the conditions currently in a lot of dental schools. Now, not all dental schools. Some have managed to train their students basically to full capacity. But a lot of dental schools have done the following. They've either cut their clinical requirements, okay? So you're not doing as much as previous years, and so you're not getting the experience clinically that other years have. They have cut the access to their preclinical laboratories, so you're not getting the hand skill practice that you normally would get. So that's an issue. And I think that these, or both, really both, preclinical and clinical, time and repetition, you could say, has been cut. So these one-year postgraduate residency programs are absolutely critical. I think that they could be a great time for you all who are interested in them to study and learn more about different procedures in dentistry and to get your hand skills up to par. So these are great opportunities for you, and I'm going to encourage you all to at the very least consider, if not outright apply and try to get in, because I think these will be beneficial programs for you. Now, I'm coming, as far as my own personal experience is concerned, I'm coming to you and speaking with you as a graduate from a one-year general practice residency program and as a 2-year director of an advanced education general dentistry program. So I was the full-time faculty member and director of the AEGD program at Temple University. So that said, what is a GPR and what is an AEGD? Well, a general practice residency, or GPR, is supposed to be a program which is hospital-based, and it provides those residents in the program with a greater experience in much more medically compromised patients, in hospital-based patients, and also in possibly more surgical-based patients and surgical-based treatment. So that is the basic premise of a GPR. What about an AEGD, an Advanced Education in General Dentistry? What is that about? Well, those programs are more geared towards, general dentistry. That is, not a hospital-based program with super medically compromised patients and things along those lines, but, your average, ordinary, run-of-the-mill patients who come in and seeking your basic general dental care. They're not hospital-bound. They're not in medically, like I said, significantly compromised situations. They're your average patients that you're going to see, theoretically, anywhere in the U.S. or anywhere on Earth. Reality. So in these programs, a lot of these programs are unique. That is, each program has its own different flavor. So a GPR may actually have, more general dental, you could say, procedures or opportunities than some AEGD programs, and vice versa. You might find an AEGD program with a lot more, compromised or medically compromised patients than a GPR. It really all depends on where the program is and the type of people that come as patients to the program. So there is a little bit, you could say, of crossover, if you want to call it that. You could say that the lines kind of blur sometimes, again, depending on where the programs are located. For example, Temple University, where I was the director of the AEGD program, we had some medically compromised patients that were pretty significant, that could easily have been seen in a hospital-based GPR program. So, you'll still see that. So it's not that GPR patients are restricted to hospitals and AEGD program, patients are not. There can easily be significant crossover. So that all said, I've already emphasized that these are important programs for you to attend, especially at this point in time. If you're a graduate of the class years 2021, 2022, 2023, 2024, and maybe even 2025 and beyond, depending on how dental schools are modifying their curricula at this point in time, I really think that this is beneficial for all of you who possibly could be thinking about it. And those graduates of even 2020 and maybe even 2019, because your clinical experiences may have been cut short and your practice experiences may have been curtailed or modified because of COVID. I think that these programs, if you're having trouble, if you're struggling, if maybe you want to have a refresher of some kind, these programs could benefit you. Now, what are the benefits aside from the extra reps or extra time, and extra studying and learning that you can get? Well, number one, you do get a stipend. So you do get paid. It's not much in most cases, but nevertheless, you do get paid for being in a program. Number two, you get a certificate, which always looks nice. I mean, it's great for educational background stuff. So you get a certificate. Number three, some states will actually allow you or grant you a license. I know New York State is one of them, to practice if you satisfactorily complete the program and have a letter of support from the program director. So you can get your dental license in at least New York State and potentially others. I know others are at least considering this. If you finish a GPR or an AEGD program. That's another great benefit. Number four, another thing that you can get as a benefit from these programs is that you can defer your loans. So it gives you a little bit of time to defer those gargantuan loans that you are all facing. Because let's face it, those numbers are huge. And so I know that it's nerve-wracking. And you've already watched my previous videos likely where I am kind of dissuading you from going to dental school if you're thinking about it because of those huge loan numbers. But this at least gives you a year of grace period. I don't know the details, but I know that I have signed letters so that these things can be deferred. So I know that that is part of a program benefit, you could say, is deferment of student loans. Red flags. So what to look out for? I mean, there are a lot of programs. So you don't just want to go to a program just to go to a program. You want to try to get into the best program you can get into. What are some red flags which may indicate a program might not be so great? Well, first of all, you want to talk with the residents of the program. And not just talk with them while they're in the building, with the faculty members floating around. You want to talk with these people outside of the building. You want to get to know, hey, what's your experience? What have you seen? They're all going to be tough. They're all going to be working hard. So you're going to hear the usual gripes that students have, which is fine. Hey, they really beat me. They really want us to do, they really wanted us to do this and get this right, but they make me do extra steps and yada, yada. Okay, that's typical. We know that. That's going to happen. But, our students or are the residents saying, yeah, we never see implant cases. Yeah, we never see root canal cases. Yeah, we never see, that's a problem. If there's a lack of clinical experience in a certain important specialty, like root canals, like implants, like you name it, crowns, any kind of lack of experience in that program or lack of patients providing that kind of experience is an issue. So you are going to want to weed that out. That's important. Another red flag. If the program has had 6 or 7 directors in 10 to 12 years, there's an issue. And it's probably somewhere at the top. That means that the leadership is changing so much that there's no real direction and the purpose of the program may not be entirely clear. So that said, those are things to kind of watch out for. You want to have a program that has a wide breadth of clinical, experience for you. But you also want to have a stable leadership, in a program that has been consistent for many, many years. So those are important things to look out for. All right, so I appreciate you all joining me in this video discussing the AEGD versus the GPR as far as programs are concerned. Please know that programs are unique, and you may find, like I said, a lot of crossover between one and the other, depending on where you are and what program it is. Each program has its own flavor. And like I said, you're going to want to get to know about that flavor by asking residents of the program what their experiences are like. Alrighty, so hope you're all well and staying healthy, and we'll see you next time. Thanks for joining me.